Barbara and I both believe in supporting the community. SSM was one of them that we chose because they were reinvesting back into our community with a new hospital and we wanted to be a part of it. My folks always told me that if you're going to live in a community, you have to do something to give back to the community. And I've tried to do that the same way. We want to stay involved with the hospital because they're doing so much good for this community and the county and actually the region. I believe this hospital will one of these days be the main regional hospital in the area.
I really think the community finds out a lot of things in the paper and they see it and they hear it. The more that we can let people know what they can contribute if they want to contribute, and it's not always money. You know, hours and hours and hours of philanthropy.
And I've told several people that just letting people know that we have a hybrid OR, we have operating rooms, we have the doctors. And these are things that some people really don't know, especially outside Jefferson County, that it's here. They don't have to go to the Metro East or to Evansville.
I remember coming in and deciding what art we wanted to give. The children's garden. I taught school for a long time, and anything that has to do with children. The chimes that are outside the hospital when you drive up, which I now found out that's part of our musical therapy.
Music therapy is our main one that we like. We believe that we should help the hospital on things that they need. The hospital takes care of the major costs all the way through, but it's just like giving you a bump up, a little bit of a head start on things. I enjoy music, for one thing, and listening to it myself. And I'm thinking of some of the patients in the rooms, and sometimes they just need somebody to be there and talk to them and play the music. It was something I wanted to try, and it seems to be a very big hit.
I do not play an instrument. I don't know music, but I can sure tap my foot. And you see this with older patients. They may be just lying in a bed, not moving around, and music comes on, and it clicks in their head. There's music, and they start tapping, or they start singing, or they start moving to it. And incorporating that with the chimes that we have outside the hospital, in the play area that we have outside the gardens, we have places where children can go and pound and make music, and it's important. And we need as much as we can get.
We try to teach our children and grandchildren the fact that you've got to continue on this stuff. And as my father and mother taught me. And we get them involved as much as we can when we have something like the Children's Garden. We had them here to see what we had donated money toward. If someone asked me about donating to SSM, I would tell them their money is well spent, and there's so many avenues that they can choose what they want to support.